Joe, thank you very much for having our Dutch patient. He just came over to you for his TILSA procedure, and I heard from the urologist that he's being sending over to the US because he has a tumor which is very close to the external sphincter. And is that the true reason that he's coming to you?
I believe so. In discussing with the urologist, his concern was the external sphincter, and I personally believe that TULSA is the best procedure for any tumor that is associated with the pelvic floor, or what I like to call the extreme apex.
Yeah.
And what I mean by that is that the tumor is involving usually the external urinary sphincter, and also maybe involving some of the pelvic floor musculature, such as the levators. And I've not seen any that involve the external obturators, but I have seen it involve the levators, no question about that.
So I'm a little bit surprised because with surgery, prostatectomy, and also with radiotherapy, these cases are very difficult because if the sphincter is involved, you need to treat the sphincter. You radiate the sphincter with DNA damage, or you cut away the sphincter into the normal tissue, and usually such a patient is having, after the procedure, problems with incontinence.
Right.
Now, how is that with TILSA? Because you also need to treat part of the normal sphincter. Don't you expect the same, I call side effects, which are terrible? I heard from a patient that incontinence is even worse than impotence because you have to wear diapers wherever you go, which must be terrible. So what about TILSA?
The extreme apex lesions and the apex lesions in general, or any lesion that involves what I just mentioned, the pelvic floor, they're difficult for all modalities. They're actually difficult for TULSA, but they're not in the treatment of TULSA. The difficulty with TULSA is the time it takes to set up. Because when you're doing a TULSA procedure, you're looking at the patient in 3 dimensions.
Mm-hmm.
And you're visualizing the sphincter in 3 dimensions. You're visualizing the neurovascular bundles in 3 dimensions. So you're keeping your eyes on both these things at the same time as the tumor. Now, these tumors do not involve the sphincter at 360 degrees. In general, they involve the sphincter anywhere from 10 degrees to sometimes as much as 90 degrees or 180. They can be pretty big.
Mm-hmm.
We think,
Mm-hmm.
and what I know after treating over 100 patients with
That's quite a lot.
apex, as long as we don't destroy 50% of the external sphincter and the pelvic floor musculature, these people will be dry. That's been my experience. So I have 0 patients on diapers and 0 patients on pads.